is grandfathering. What are the perceptions? How are companies handling it? Maybe back to that.
Well, I'll start. Of course, we've heard some really nice definitions of grandfathering to help out. The good news is, and I don't know if, I'm not sure that either one of you had mentioned this, was that for employers like mine who offer several different plans, all out of the same trust, but each plan can be grandfathered on its own. So we do offer several different plans. Chances are, because of the limited ability to make plan designs or to pass along any costs to our employees, that the majority of our plans are not going to stay grandfathered. That's probably a given. Although there may be a couple that we want to grandfather because there are a few things that are important to us that we preserve in specific groups. So I think that we'll see more, and we'll rely on Blue Cross to do all the documentation for us.
Great.
One thing I'd add, I think we've talked a lot about that, so I wasn't going to get into details, but one thing that we've heard when we've talked to our plans as we work on comments to the regulation is, I think the communication between the employers, is particularly the self-funded employers and the insurers, and employers can change cost sharing, and if the plan doesn't know, in some instances, sometimes our plans have said we're worried because we might not know if the employer makes some changes to the cost sharing or to some of the structure of the payments. So that communication back and forth is going to be really key because plans will have to account for the grandfathering status, and I think it's important no one's caught by surprise that you are or aren't. So maybe before even making changes, you probably want to have that communication going on to understand how your plan, Blue Cross Blue Shield of Michigan in this case, is interpreting it and how you are in the changes before you go ahead, because once those changes are made, it could have an impact.